Hello, this is the training and fitting for the AAC device mid-tech for Angelique or I for the parents, staff, and therapist. This presentation has been revised by Dr. Padin and it has been put together by the student clinicians Jamey Morales and Lilian Obando. This slide shows the different goals that we have created for the patient to be able to accomplish after this training. The first goal that we are trying to achieve is that through the training and the use and implementation of this system, the parents, the family members, the center staff, and other participants will learn how to program the system. They will be able to select words or phrases to use depending on the environments. They will motivate the use and educate others about the system, and they will expand the use of the system, adapting it to the age and development. The second goal will be to increase the use of greetings, providing personal information, and ways of initiating interactions using the mid-tech system. The patient should also be able to respond with functional yes and no questions with the use of the system. She should be able to engage in multiple contexts and activities of life utilizing the system. And lastly, she should be able to increase ADL's receptive vocabulary for multiple concepts and generalizing to different environments. The mid-tech device that has been chosen for the patient is called the Big Mac. This is a device that allows patients to communicate by using a large colored top button that allows the individual to send a single message for up to 2 minutes long. New messages can be easily and quickly be recorded in order to provide different opportunities for the patient to communicate in different scenarios. As part of the first goal, we have to implement a training for the parents, the family members, the center staff, and other participants. Some of these participants include the occupational and physical therapist, the nursing and the support staff, the parents or the guardians, other family members. Some examples could be the teachers, the paraprofessionals, etc. For the second goal, we want to be able to increase her use of greetings and providing personal information. In order to do this, there are a few activities that we can engage in. The first one can be role play, so we can provide some scripts in order to engage the patient and also reach our goals. The second activity can be using greeting cards, so we can prompt the use of greeting and personal information by using the cards as cues. And then the third activity that we can use is answering personal questions such as her name, her date of birth, and her age.
Goal number 3 is to respond functional with yes and no questions with the use of mid-tech AAC system with 90% accuracy, requiring minimal moderate support. In order to work on this, you can use picture cards to respond to yes or no questions. These questions can include everyday items, activities of daily living, and action verbs. You can also use questions of preferred activities, questions that can establish her preferences, and like that she can state her likes and dislikes. And you can use questions such as, do you want more chocolate? Goal 4 is to engage in multiple contexts and activities of life utilizing the mid-tech AAC system with 90% accuracy, requiring minimal moderate support. In order to target this, you can use core vocabulary in different contexts. You can add common phrases such as I'm hungry or I want to watch TV. You can also role play to practice different communication skills in contexts and activities, and these contexts can include school, home, and clinic, and you can include scripts for her to follow. Goal number 5 is to increase receptive and expressive vocabulary for multiple contexts and generalizing to environments of activities of daily living with 90% accuracy, requiring minimal moderate support. In order to work on this, you can use picture cards. These picture cards can elicit receptive and expressive language, and as you use the AT device, you can expand vocabulary according to the environment where the patient is at. You can also verify that the patient previously knows what the word, object, or concept means before you begin implementing it. And you can use familiar words, simple and in tune with her personal experiences and the main ideas in order for her to have functional communication. When you begin to use the device, it is important to select the number of buttons that are necessary and to not exceed it because it can cause confusion and it also increases frustration. So in order to work with her, you need to be patient because her responses are slow due to her physical limitations, and it takes her some time in order to move her arms and to be able to select the specific button that she wants in order to respond. You also can repeat and verify your questions if you have doubts about the answer that she has provided. You also need to be able to scatter the buttons on the board in order for her to not select the wrong button by mistake. And it's also very important to use the device for everything, as this is her new voice and her way to communicate and be able to be understood. So in this part, we will be explaining how you can record a new word or phrase on the buttons. So what you would do first is you would turn the button upside down. You would press the button, the small button on the bottom, in order to record. You will say the word or phrase aloud. After you hear a beeping sound, you can make sure that your voice is understood and loud enough. If not, you can go ahead and repeat the process until you are satisfied with how the word or the phrase is coming out of the button. It is also very important that the buttons are of different colors and using an illustration above so that she does not get confused when going to press a button. It makes it easier for her.
Yes. I want to stay here. No. I want chocolate. 11 years old. I need help. I am Angie.
Lily, do you want chocolate?
Yes.
Okay, do you want to go home to your house? Tell me again, do you want to go home?
No.
As we come to the end of our presentation, it is important for us to let everyone know some of the words and phrases that she has already been using through the buttons as response to questions. So some of them have been, my name is Angeli, to her question of what is your name. She has answered, I am 11 years old, to the question of her age. She answers yes or no questions. She will press the button that says I want chocolate when she wants a snack. She has also pressed the button for I need help when there is something that she wants or for attention. And when she has been asked if she wants to stay in the room, in the therapy room, she has pressed the button that says I want to stay here.